Welcome to This Explainer. I'm your host, and as a medical educator representing Westminster Multispecialty Clinic right here in Dubai Healthcare City, I am so incredibly excited to guide you through this today. There's this very specific kind of energy in the air right now, isn't there? Families all over Dubai are booking those summer holidays. Flights are locked in, hotels are sorted, and we're all pretty eager to make the Dubai summer heat someone else's problem for a few weeks. But today, we're going to frame our discussion around something absolutely vital that, well, it often gets completely left behind in all that packing and planning. We're going to look at the actual clinical reality of travel health, pulling directly from our daily patient experiences to show you exactly how a true pre-travel consultation works. Okay, let's dive into this. Think of this as our roadmap for a typical, highly personalized travel consultation at Westminster Multispecialty Clinic. We'll start with the forgotten packing item, move to how it's more than just jabs, cover destination-specific risks, managing chronic conditions, protecting families, and finally, planning ahead.
Section 1, the forgotten packing item. You know the rush, right? You're grabbing new luggage, fine-tuning the itinerary, maybe picking up some new summer clothes. But in all that excitement to escape the heat, practical health preparation usually ends up dead last on the to-do list, assuming it even makes the list at all.
Which brings us to this incredibly common question, and honestly, a massive misconception we see all the time at Westminster Multispecialty Clinic. Is travel health literally just a quick jab? You pop in, get a shot, and you're good to go? The short answer is absolutely not. Look, a destination is way more than just a pin on a map. When you travel, you're stepping into a completely different climate, a totally new food environment, you're facing different infectious disease risks, and you might be relying on a medical standard that's vastly different from what you're used to if something actually goes wrong. And that's exactly why our family medicine team operates on a pretty straightforward philosophy. A pre-travel consultation is not a checklist applied uniformly, but a genuine conversation. What we do is deeply, deeply personalized. We really want to know the nuances of your specific itinerary, we want to know what activities you're doing, and we really dive into your individual health history. Because let's be honest, generic advice just doesn't cut it when your health is on the line thousands of miles from home. Moving right along to Section 2, more than just jabs. Let's talk about how we clinically assess your actual travel risk profile based on what you'll realistically be doing. And this brilliantly illustrates exactly what I mean. A quick city break in Western Europe has a totally different risk profile compared to an East African safari. Seriously, even if two people are flying into the exact same country, what they do there matters immensely. Are you hiking? Are you swimming in open water? Maybe you're working with animals or volunteering in a clinic. A standard tourist just wandering around museums faces vastly different risks than someone who's trekking through a rural landscape. But before we even think about exotic travel vaccines, we have to look at the foundation, which is your routine immunizations. At Westminster Multispecialty Clinic, what we see with our adult patients, and this happens all the time, is a genuine surprise when they realize their childhood vaccines have completely worn off over the years. Or maybe they were never fully completed to begin with. And that is so incredibly common, absolutely zero judgment here. The gaps we see the most, tetanus, hepatitis A, typhoid, and influenza. Getting these updated is absolutely essential for almost any trip you take, not just the remote off-the-grid ones. All right, on to Section 3, destination-specific health risks. We're talking about the geographic realities and strict legal requirements that demand some really careful medical planning. Now, what's really interesting about this slide is how specific vaccines map directly to corresponding global regions and risk factors. Take yellow fever, for instance. This isn't just a polite health recommendation, it's a strict legal entry requirement for parts of sub-Saharan Africa and South America. No vaccine, no entry. Then look at hepatitis B. We highly recommend this for longer stays or if there's any chance you might need medical or dental care abroad. And of course, Japanese encephalitis, which is a massive consideration if you're planning an extended trip or staying in rural parts of Asia. It really just goes to show why that generic checklist approach we talked about earlier simply fails. We absolutely have to talk about malaria. Now, it doesn't come up a lot in everyday Dubai conversation, sure, but it is a very serious risk in parts of Africa, South Asia, and Southeast Asia. The good news? It's entirely preventable. But anti-malarial medication is definitely not a one-size-fits-all kind of deal. The right drug depends entirely on your specific destination, your age, and your personal medical history. Plus, pills are really only half the battle. We also focus heavily on mosquito avoidance. So using the appropriate repellents, making smart clothing choices, and setting up safe sleeping arrangements. Next up, Section 4, managing chronic conditions abroad. For our patients living with things like diabetes or hypertension, a pre-travel consultation isn't just a good idea, it's absolutely critical. you really cannot just assume things will be fine just because you manage your condition perfectly well here at home. Travel fundamentally disrupts your routine. Crossing time zones completely throws off when you should be taking your insulin or oral medications. It's really not always intuitive. On top of that, extreme heat and humidity can actually change how your body absorbs or responds to your medication. Add in the fact that your physical activity level on holiday, whether you're walking 10 miles a day, exploring a new city, or just crashing on a beach, will likely cause your blood pressure or blood sugar to shift pretty drastically. Let's move to and see how this builds into practical logistics. Our chronic disease team at Westminster Multispecialty Clinic actually sits down with you to create a really concrete plan. Step 1, we optimize those medication schedules for your new time zones. Step 2, we pinpoint the specific symptoms you need to monitor while you're away. And step 3, we get all your custom documentation prepared. We even teach you how to properly store temperature-sensitive drugs, like your insulin on a long-haul flight. It's all about taking the guesswork completely out of the equation. Section 5, Protecting Traveling Families. Traveling with kids introduces a whole new layer of clinical realities and some very unique challenges that need dedicated prep. When you compare adult and pediatric travel health, the differences are absolutely vital. Kids respond differently to vaccines than we do. They have completely different options for malaria prophylaxis. And crucially, children are just far more vulnerable to foodborne illnesses and severe dehydration than adults on the exact same trip. They need highly specialized guidance on safe food, safe water, and using insect repellents that are actually age-appropriate. Our ultimate goal when talking with parents is super simple. Know what symptoms to watch for and when to seek care abroad. By giving parents this highly specific knowledge before they ever leave, we provide what we like to call a quiet confidence. It drastically cuts down on the panic and the stress of having to blindly navigate a foreign healthcare system if your little one suddenly spikes a fever. And that brings us to Section 6, the case for planning ahead. Let's talk about the logistics of timing and why booking early is a strict medical necessity. Look, even with the absolute best preparation in the world, people still get sick. Traveler's diarrhea is incredibly common, for instance. What you really need is a basic travel health kit, the knowledge to recognize which symptoms actually require a local doctor, and a very clear understanding of your travel insurance. But also, please remember that our team at Westminster Multispecialty Clinic in Dubai Healthcare City is here for you when you return. Some infections you pick up abroad have really long incubation periods, so if you feel unwell in the weeks following a trip, getting a post-travel assessment and the proper testing is essential. Your care absolutely does not stop just because you've unpacked your bags. Looking at the reality of this timeline, this is exactly where the biggest mistakes happen. Some vaccines require multiple doses spread out over several weeks. Others literally just need time for your body to build the actual antibodies before you leave. Arriving at a clinic 2 days before your flight and expecting full protection is unfortunately clinically impossible. This timeline shows exactly why you need to book your consults 6 weeks out, keep an eye on symptoms mid-trip, and follow up post-travel if you need to. So the crucial point is right here, 4 to 6. 4 to 6 weeks is the absolute minimum lead time you need to book your pre-travel consultation. This ensures we actually have the time to assess you properly, administer any multi-dose vaccines, and give your body the necessary time to build up full medical protection before you ever step foot on that airplane. Which leaves us with one final, very important question as we wrap up this explainer. Have you packed your health plan? Dubai is home to an amazingly mobile population, and we want your summer travel to be memorable for all the right reasons. Definitely not because of a totally preventable medical emergency. So, before you zip up those suitcases, reach out to our team at Westminster Multispecialty Clinic. Let's get your health preparations sorted so you can travel with absolute peace of mind. Thank you so much for joining me today, and hey, safe travels!